we're going to introduce Mr. Dermott Ryan. Thank you so much for joining us, Dermott. And you're our
Good evening,
patient.
everybody.
Good evening. And it's very unique to have a perspective from a patient on a disease. It's very rare on these panels where we're able to invite patients and really hear your journey, what you had to go through to get diagnosed, to get treatment, to get access to treatment, and sort of what that journey is. So I'm going to turn it over to you. If you could kind of tell us a little bit about your journey, that would be great.
Obviously, I must be a good student. I'm invited on here this evening by Dr. Karpecki. He's my caretaker. He's done a wonderful job with me. I guess I've been going to him for 4 or 5 years now, Paul.
I think that's right.
Yeah. So he can probably tell you how bad I was. I mean, better than I don't understand all the technical side of it, but he can tell you how bad I was, and I can tell you how good I feel now. He introduced me to, I'm on Xydra twice a day, Lumify, just in the morning, that's all. I used to be taking the Refresh eye drops. I take them 2 or 3 times an hour, I'd say. Depending if I was inside in a room versus if I'm outside, I don't need them as much. But he introduced me to the Demodex, and I started it on December about the 1920th. And I went back to him about a month, just over a month afterwards. And he told me that I had 100% cleared up, or maybe 2 eyelashes you could find it on, and to finish out the Demodex. So I did it solid to his instructions for 6 weeks. And since then, I find I'm not really using the Refresh drops at all. Just a rare, I have them with me because I've been for years carrying around in my pocket all the time. But now I just have them, but I'm not really using them. So once I use my Xydra in the morning and Lumify, I can get pretty much the whole day now until I get my Xydra again in the evening. And I'm good. So thanks to Dr. Karpecki. I'm very grateful. It's made an amazing difference to just my daily life and what I do.
Wonderful. And so,
Thanks,
so you took the 6 weeks of Xdemvy, and basically your need for, it sounds like, the artificial tears and all of the other dry eye treatments.
Actually, sorry, he did introduce me back then to the Mibo, and I'll use that maybe twice a day. I'm actually out, Doc, okay? Hopefully that's something.
That's great. Now that we've gotten the culprit out of the way, you may continue to see that decrease in everything that you've described. I love it.
And
Yeah,
Paul, I was going to say, Paul, can you maybe sort of talk about the journey you had with Dermott as well, and how long he was in your care before this, and sort of what you found with his case?
I'd be delighted to. And Dermot's a very typical patient we would see in our clinic who diagnosed a dry eye and did, given his gland loss, he definitely has a dry eye component. And again, we had Xdemvy years ago. We may have prevented that for sure, but didn't exist. And so we were, so we have an evaporative dry eye component that goes with that. And he has an ocular rosacea component. And that seems to be a very common combination with Demodex blepharitis, but we were always missing the Demodex component. So we have done, the typical things that we had prior to that. I mean, early on, since he's been with me for 4 or 5 years, we probably even tried tea tree. We've moved more towards, because of its burning and its stinging, we've advanced from that to maybe a Manuka-based cleaner, but that never seemed to work if you had any significant blepharitis. It is more of a maintenance. And it would work if we had some, a milder case perhaps, but very comfortable. And as I said, probably good for maintenance. And we did IPLs because that was really about our best treatment, but didn't know oftentimes to do a treatment in that last 6-week time frame. But as Dermot could tell you, that's probably a little more of an expensive approach to getting Demodex to a good level. And then when, I had a list of, I would say, a couple 100, 300 patients that, like you, Marjan, that we kept saying, we've got something better coming. We have something on its way. And Dermot got to hear that many times, year after year, that it would be here. And then when he came in for his visit at the end of last year, we were able to go ahead and put him on Xdemvy. And a good patient. I brought him back in a month just because I wanted to kind of see the effects, see how he's doing. And he described it better than I could. I mean, he was really down to maybe 1, 2 collarettes, nothing there, really a great clinical cure rate, pretty much 100% when you're down to that. And then on his last more recent follow-up, I couldn't find any whatsoever. And of course, he stopped using that medication for 6 weeks. And I love the fact that he's able to get off of all the other medications. The artificial tears are down. He's reduced other therapies. Again, I think because in Dermott's case of having the comorbidities of ocular rosacea and having also the fact that it had progressed to where it is an evaporative dry eye disease, he'll still have some components there for regular treatment. But because we've finally eradicated what I think is the primary cause, everything improves, including his quality of life, his dosing, his requirement for another IPL or whatever may be necessary, and even other medications. So fortunately, and Dermott, great job. I mean, so eloquent, so well stated. But it's a very typical type of patient that we would see in our clinic, and really very typical results. So I don't want to say we chose Dermott just because he's so well spoken and a great guy, but his response is so. I could have picked 100 patients who would say very similar responses with their Xdemvy experience.
Wonderful. And Dermott, can I ask you one more thing? Is before you did Xdemvy, what was the impact? How were you feeling your day-to-day symptoms before you got the correct treatment? What was the level of frustration?
I wouldn't call it frustration. I just learned to live with it. And it varies, and I'd be obviously still am, but mindful of being in your car with the AC or the heat. You just won't have it blowing in your face. Little things like that trigger it and set it off. Being in an extra warm house or something like that, and the air blowing, you'd be mindful of all those little triggers. But I've kind of forgotten about them a lot now lately,
Yeah.
Where it's more normal. But actually, the fact that I'm not carrying as much with that refresh, I'd carry about a pack in each pocket, always have them with me. I couldn't leave the house without them. Now I barely have 1 or 2 in my pocket a day walking on, and I'm fine. I'm not, anxious to know where they are. But I also find the rosacea, when I get treated for that too, has been a help in the past. So
you said something so valuable. We call them symptoms, and you call them triggers, which is pretty nice to hear. So that's excellent. That's such a great story.
Okay.
And we've heard this so many times from patients that they sort of live with their symptoms because they really, it had become part of their normal, and you would sort of manage and do the best you could.
Yeah, you don't have a choice. You just get on with it. That's it.
Right. And one patient that I talked about earlier was my mom, who I noticed she had significant collarettes. She really didn't complain about anything, but when I started her on Xdemvy and she went through the treatment, she was raving about how good her eyes felt, because all the time her eyes hadn't felt good. But she's not somebody who complains, and she sort of dealt with it and managed. And only when she noticed the difference on how her eye feels was she like, oh my God, my eyes feel so much better than they did. And I think that's really important because a lot of patients have sort of dealt with the burden and managed, if you will. So we hear that a lot. Derek, do you hear that from some of your patients as well?
Absolutely. There are patients complain about things when they're really bad, and they complain and they rave about things that are really good, and that's what we've heard with Xdemvy, which is really nice. So it's nice to have patients walk in the door and be happy and not have a complaint. So it's a very nice thing to deal with now.
It's not hyperbole, but as a cataract surgeon, I have the fortune to rehabilitate people's vision, change people's lives, and the patients come back to us very commonly with this sense of gratitude and appreciation for what we've done. The only thing recently that compares to that same euphoria of restoring vision is when you take a patient with a chronic disease that's been bothering them for a decade, and you solve it with a very simple drop twice a day. And the euphoria and gratitude of these patients who've been placed on Xdemvy is one of the most remarkable aspects that I've seen since the launch of the medication.